First of all, hello and welcome to the live broadcast of Clinic-Wise with Dr. Ersin Gonullu. My name is Lina and I'm a patient coordinator here. Today we will talk with Dr. Ersin about the secrets of, about 360 liposuction, BBL and other body surgeries. Feel free to ask all your questions below to the comments and we will try to answer as much as we can. First of all, how are you, Dr. Ersin? How is it going?
Yeah, I'm so excited to being here, and thank you for this opportunity, and hopefully it will be beneficial for all our followers, and I will try to do my best to answer
yes, I'm also excited to answer all their questions. So I prepared some frequently asked questions, which are mostly asked from the patients. So we can start with them if you are ready. Okay. Great.
Okay.
So let's start with our first question. The first question here, it's a general question. And the question is, how much fat can be harvested during 360 liposuction? And according to this question, how much fat can be injected to the bum?
Okay, you know, this question is very, self-tailored, has a very self-tailored answer because it depends how much fat you have before the operation underneath of your skin. If you are not an obese patient and if you don't have any kind of obstacle for the operation, so you are a good candidate for the liposuction to make your body shape better. And with some kind of special techniques, thanks to the aggressive liposuction technique, we are able to remove up to likely 80% of the fat underneath of the skin safely. So before the operation, for example, if you have around 5 liters on your trunk in 360 approach, so 4 liters is available to remove it. But if you have 10, so we can go up to 8 liters. And then after harvesting all this fat, we are purifying it. We are doing some kind of applications to it to prepare it for a safe fat injection procedure. And it depends how much space you have underneath of your skin on the bum area, on the hip tips and the projection area and the space between them. We are putting all the fat underneath of the skin, between the skin and the muscle fascia, just right into the fat tissue, which is the safe area. So we are expanding the skin to make the space as much as possible with some kind of special machines, which are called power-assisted liposuction machine. And after making this space as much as possible, then we are injecting all the fat inside. But everybody's capacity might be different. So this injection amount might be from 500, 600 cc's of pure fat to up to 1.5 or 2 liters to each side. So it depends, you know, on the patient's needs and the capacity.
Thank you for the detailed explanation. So here, like we talked about fat injection to the bum, which areas are suitable for fat injection in our body? Yeah,
theoretically, we can put the fat injection to the fat in all necessary areas on our body, which have some kind of inadequate volume underneath of the skin. From up to down, if we need to mention about them, you can put the fat on the forehead, on the side of the forehead, on the nose sometimes, on the lower eyelid, upper eyelid, cheekbones, nasolabial area, around the lips, and maybe for the jawline in some suitable patients. If you have any kind of deformity on the body, it doesn't matter where is it, so it can be fixed with fat injection. One of the most frequent areas is breast tissue for women, and the bum, as you know, and the calf area also. These are the most frequent fat injection recipient areas.
So there is also G-plasma, which is a really known skin tightening treatment. And may you share its advantages and its method with us so we can help also with the questions?
Okay, you know, G-plasma is still a new brand technology, but we are being used for a couple of years, and it's game-changing machine, you know, because if the patient have an exact skin sagging and skin excess, especially on the tummy area, mostly it's usually because of previous pregnancies, childbirths, or massive weight loss history. So in that case, we are free to do a tummy tuck surgery for this kind of patients. But if your skin is too tight and if you don't have any kind of sagging or excess skin, so you don't need to do anything to tighten skin. Just only liposuction is making a good skin tightening and shrinking effect by time. But in some kind of mild and moderate skin looseness patients, we wouldn't used to do a tummy tuck surgery. We couldn't do it because it's too big, too massive surgery for them. But otherwise, once you don't do any kind of lifting surgery, so there is a risk of excess skin or irregularity or sagging skin in long term. The J plasma is working on these patients especially, but sometimes some patients doesn't prefer to have a tummy tuck surgery, even they have 100% tummy tuck indication also. We are trying J plasma in these patients again, if they prefer, and we have very good results in some of these patients. It depends because of the skin reaction also, because the J plasma is based on an radio frequency and helium plasma energy. It's, in other words, it's making a burning effect, but it's controlled burning effect under the skin. So with that way, the skin is getting immediately contracted and get smaller, but this effect is lasting up to 6 to 9 months after the surgery. But everybody's body reaction is different, and the only variable is not the J plasma, and for sure the aftercare and the massages and good diet and exercises is affecting it also. If you do all these things together and if you use all the weapons you have, so you can have the best result possible in your body structure.
It depends also on the aftercare, like you mentioned. That's also a really important point here. So I'm continuing with the next question. And the question here is, how long do I need to wear the garment or use the BBL pillow after the surgery?
Yeah, that's the one of the main questions. We recommend everybody's application might be different. Every surgeon might advise different things. It depends their experiences. In our experience, usually about 1 month time to use the garments would be enough, usually mostly. But after the first month, we are absolutely making check to all the patients in abroad or the resident patients. So after checking them, it depends on their current situation after the first month of the surgery. If they still have too much swollen or if they need to use the garment more, so we need to recommend to use it maybe a couple of more weeks. But usually it's about 1 month time. And the BBL pillow is just to support the patients in order to not to make unnecessary too much pressure on the bum, because the first enemy of the injected fat is the pressure on the bum. So we need to put the pillow under the thighs in order to make less pressure on the bum. And in about up to 2 to 3 months, the injected fat grafts, which are alive tissues, and they need to stay alive to make a permanent result, they are getting stable in about up to 2 or 3 months. But after that, you cannot kill them anymore. So it will be stable with you for
approximately 2 or 3
lifetime.
months are okay to use the BBL pillow. Do patients also use them if they are only injection fed to their hip dips? If there is only injection to the hip dips, do the patients have to use the BBL pillow as well?
Yeah, but it's a very, very rare case to put only fat into the hip dips, because technically, while we are doing the operation, the first target area is always the hip dips. The most problematic area is the hip dips and the most depressed area, and usually, the most resistant area for expansion. So for that reason, in order to make a good harmony on the bone, we need to expand the hip dips as much as possible. After that, to make it more smooth and round shape, we almost all the time need to put some fat on the top and on the back part of the bum. So for that reason, only hip dip fat injection might not be realistic thing for us, and we recommend for all patients to use their
That was also
BBL
great
pillows.
information, which is always asked, since patients don't want to use their BBL pillow for a long time because they are going to, and so yeah.
Yeah, that's right. I understand them. It's not easy to use it. You need to carry a
Yeah,
cycle
because
bag
they are
with you.
asking how long do I have to take it with
Yeah,
me to work. Yeah.
yeah.
Okay, I will continue with the next question here. So here the
Okay, for
question,
sure.
when can I get back to work after the body surgery? Maybe you can explain it for BBL and also for only liposuction as well.
Okay, it depends what kind of occupation you have, firstly, and the additional procedures might make a difference about it. So if you have an, office work, just sitting in front of a table, on a chair, usually about 2 weeks is enough to go back to work. But if you have an additional procedures such as tummy tuck surgery, breast lifting reduction surgery, that time might be prolonged up to 3, maybe 4 weeks. So it's approximately about 2 to 4 weeks time. It depends on your occupation and on your additional surgical
And when
procedures.
they can start to work a bit harder or lift something or start exercising after these procedures?
Yeah, the answer is very simple. Just once you feel yourself strong enough. And if you don't have a fat injection procedure, it's up to you. You can start to do harder exercises in about 3 to 4 weeks. But for BBL patients, we do not recommend to do it up to 2, maybe 3 months, because we need to keep the fat stable, and after then you can do the exercises more freely.
That's also important because they mostly wanted to start exercising after their surgeries, and like you said, for BBL, it's
yeah, it's a must after the surgery for sure, because it's a teamwork. We cannot have a successful result with only our effort. So the patients should be a player. They are good aftercare, and they need to be our first supporter after the surgery. That's why we are not interrupt the contact with them and check them all the time after the operation also.
That was the most asked question. So I will go with the next question here. And the question here is, that's a patient question.
Yeah.
Can I have both breast and Safe BBL surgery done at the same time? Maybe you can here also add all the combined surgeries which can be done at the same time.
Yeah. Somebody thinks about it. If I need to have a BBL surgery, I cannot have the tummy tuck or breast. But it's not that much true. It depends on your priorities. So if your first priority is just to keep as much fat as possible survived in the bum, so it's better to separate each surgeries, because once you have a surgical lifting surgery such as breast lift, implant, or tummy tuck surgery, you cannot lie on your front after the surgery. So you have to lie on your back. We are giving some kind of support in this position while they are lying on the back. We are putting something under their waistline and the thigh region in order to make the pressure less on the bum, but you cannot make it zero. So if your first priority is not the BBL surgery, so why not? You can have all these things together, like a mommy makeover surgery, or you can combine the tummy tuck surgery with the BBL and the breast surgery as well. It doesn't matter. And we are doing this kind of combinations so much
it depends,
frequently.
like you said, on the priority of the patient and about aftercare, etc.
Yeah, because once you do all these surgeries together, you need just one recovery time, one general anesthesia, one hospitalization, one government time, which is taking about 1 month time. But if you want to separate them, you need to make all these things double. So it has advantages and disadvantages.
So it depends on the patient's priority, like you mentioned.
Yeah, it's about the priority. We are just applicators, so we are doing whatever they want.
Really important information, since mostly patients are asking for combined surgeries, or they are mostly afraid to have all at the same time. So I will be continuing with my questions here. Another question here is, you are known for natural results, especially Safe BBL results. You mentioned also before, in the questions before, like how much you are injection to the bump, but the patient is asking for, what if a patient is asking for extreme projection? Would you do it if it's possible, like for natural results, but for a bigger bump?
Okay. So let's explain what is projection and what is the side projection. The projection means the distance between your lowest part of your lower back and the highest part of your bum. So honestly, to make this distance more with liposuction and BBL, fat injection surgery, the main thing is the liposuction. Because of that, we are making much more aggressive, the most aggressive liposuction right above the bum area on the lowest part of the waistline. So it's making the distance more. In fact, it's not making a real projection. It's making an illusion and change the distribution between them. But if the patient requests a really big and strong projection, the only way is to get a butt implant. Without implant, with only fat injection, it's not possible to have this kind of strong projection safely. So for a safe surgery, we need to keep in the limits. And once the skin on the bum is making some kind of reaction, like rashes, like bruises, or like getting too hard, so after that, you need to stop in somewhere. Otherwise, the skin will start to make bad reactions like necrosis, like blood circulation problems. So for that reason, if a patient wants a strong projection, the only choice usually it's a body implant. You can combine the surgery with a body implant and the fat injection. But if they want an exaggerated result with a very big bump, usually just only one session of BBL surgery might not be enough. They may need a second or third round.
So when would you recommend to come for a second round?
If they want a bigger bump, so usually
so they can come like after home, like after 6 or 7 months approximately?
At least 6 months, because the recovery time is at least 6 months.
So I will continue with the next question here. That's also a patient question, and the question here is, how long does it take for a muscle repair to heal, and what type of stitches do you use? That's a tummy tuck question right now. Yeah.
For a tummy tuck surgery, yeah. The muscles are getting separated while the pregnancy because of the expansion of the abdominal muscles on the tummy, and even you do so much diet and exercises, it might not be possible to get rid of this separation properly after the pregnancies, especially after multiple pregnancies. This situation is getting more. So for that reason, on the tummy tuck surgery, I'm doing a 360 lipo, as always, and remove the skin below the belly button in order to get rid of all the sagging skin. And it's 100% guarantee not to have any more sagging skin. It's the advantage of the tummy tuck surgery. And once we raise the tummy skin flap, we can see with our own eyes the separation amount on the midline above the belly button and below it also. We are using very strong and thick absorbable sutures, which are absorbable but in very long time absorbable sutures, in order to not to make a permanent reaction on the skin. But these sutures are making a fibrosis, which is a very strong tissue to keep the muscle edges together. And after it's getting absorbed, after a couple of months, just this fibrosis is keeping the muscles together and doesn't allow to separate them again. So with that way, yeah. And I'm putting this repairment sutures at least 2 different layers If needed, it might be 3. And if needed, we may need to put a mesh in order to make it more strong, like a hernia
For
patients
the
also.
stitches, it will take approximately a few days to totally remove. Am I right? The stitches,
Sorry, could you
so
repeat
it will
it
take a
again?
few days to totally.
No, it will take
Months to
a
totally
couple of months.
dissolve, yeah.
Yeah, yeah, for totally dissolve, it's
Okay.
taking around 9 months.
So I will continue again with the patient question. It's also similar, like you said. I have got a lot of fibromes in my uterus, and my stomach is a little big. Because of them, she has approximately 20 of them. Can I make a BBL? That's her question.
Yeah, that's not an obstacle for this operation if they doesn't have any general health problem to the patient. But for sure, because of this fibroids will push the muscles out, she may not have a proper, complete flat stomach. But the only thing is this. But if you can have an operation to remove her fibroids, so she can have a better, flatter tummy. So it's not an obstacle for this operation, but the result might be different in this patient.
So, and here another question is there a recommended BMI for patients for body surgeries?
Yeah, BMI absolutely is a very good, finding for us, and it's giving us an opinion about the patient's body structure, but it's not enough. We cannot make a decision on only BMI because it's a calculation of the body weight and the body height to each other. So if your bone and muscle structure is more prominent in your body, even you have a high BMI, you might be a good candidate for the operation because your fat tissue underneath of your skin would not be too much, even you have a high BMI. But the opposite of this, if your bone and muscle structure is weak, so you might not have a good candidate even you have low BMI, below 30. So the BMI is making an opinion for us, giving a good information, but it's not enough. We need to see at least the patient's pictures, standard pictures from all around the body. And sometimes we need to, request some kind of videos in order to see how much thickness of fat they have.
We are asking always the tummy pinch.
But usually, approximately, the highest BMI is around 30, but it's not a 100% rule. Sometimes the higher BMI might be suitable, sometimes lower BMI might not be suitable.
That's why we are asking, like you also mentioned, like tummy pinching video to see the amount of fat. We are asking for medical history, which are also important to decide,
Yeah.
So here.
Yeah, more information makes us more confident about
to have
the
a decision from your side. So since we are talking also about sicknesses and other things here, a patient question again here. She asked about it is not suitable to have the surgery done if a patient has AS genotype. Can you share more information about that?
Yeah, AS genotype is something about the blood, about the red blood cell. The red blood cell normally is a round shape and spheric shaped blood cells, but in this kind of patients, the shape is getting different, and because of that, it's making some kind of occlusions inside of the blood vessels, and especially on the operations, big operations such as liposuction, because of you are removing the fat from underneath of the skin, you are making a trauma to the body. And this kind of operations are exactly making a harm to the blood vessels. So for that reason, we have limits. We need to keep some blood vessels in order to keep the blood circulation properly underneath of the skin. But if you have this kind of problems, which are making the patients more prone to the blood vessel occlusion, so the risk might be higher. The AS genotype is a sickle cell trait. It's not a disease. But the risk is higher in these patients also, not only in sickle cell disease patients, which genotype is SS, not AS. But in both patients, the risk is higher. In SS patients, the contraindication is most stronger, but in AS patients, these patients have relative contraindication for this kind of surgery. But as our motto is keep the patients in the safest way possible, because our operations are not a cancer or bone fracture. They are not 100% necessary for surviving the patient. So for that reason, it doesn't make sense to take that much risk, put the patients in danger. For that reason, we do not recommend to a 360 liposuction or tummy tuck or breast surgery for this kind of patients. It's not 100% contraindication, but we do not prefer to do it.
That's something which is not suitable for surgery. There's also another general question about that. Which patients are not suitable for lipo and BBL and other body surgeries you are performing?
Yeah. First of all, if you have a major health condition such as diabetes, so you are not a good candidate. Or if you have a blood problem, blood disease, like a sickle cell disease, or a significant anemia, or any kind of general anesthesia obstacle, so we cannot do the operation. Too much high BMI is making you out for this kind of operations. And if you have any kind of local problems, such as very significant scars because of your previous probable operations, you might not be a good candidate for this kind of operation. One more thing is the body fillers. Unfortunately, most of the clinics and the patients think about it. It's one more alternative for the BBL surgery. Instead of fat injection, they are using body fillers, which is a very problematic thing. I think it's making too much complication after applying it. And this kind of body fillers, especially when they are injected into the bum or hip tips, they are not making a good and strong effect like a BBL surgery. By the way, for a small difference, it's applying too much in these days. But these body fillers are always a potential of serious infections. Infections might be in the injected area, localized, or it might be poison to blood, which is a life-threatening thing. So for that reason, we do not prefer to do an BBL surgery for the patients who have body fillers.
And for example, if a patient has fillers in the bum area, are you performing 360 liposuction to them?
I don't prefer to do it because the risk is higher than the other patients in these patients also. Because the potential of the infection risk is the same.
The most questions which are coming from the patients, because they are thinking if they have filler in the bum area, they think mostly they can also have only the liposuction done, but like you said, the risk is the same.
Yeah. So just for not to make a misunderstanding, I need to explain this once more maybe. The body fillers is not a certain contraindication for this operation, but the infection risk is all the time higher. So for that reason, we do not prefer.
That was a better explanation to avoid misunderstandings. So I will continue again with questions. That's also a patient question here. I think we talked about this. There was a question like how long does the fat injected with BBL remain in the body?
Forever after 3 months.
Yeah, we talked also in detail in the last question here. Another question here is about the post-surgery. What medication is given after the post-surgery and what are the main points of the aftercare?
Okay, we need to protect the patients from any kind of complication while the surgery and after the surgery, and we need to keep them as much comfort as possible. So for that reason, we need to keep away from infection. We are giving them antibiotics. We are giving them blood thinners in the day of the surgery, after the surgery, to keep them from a possible blood clot issue. And the other thing is the painkillers. We have so much choices and different strong painkillers. We are giving the painkillers in different patients, enough doses for them. And some patients need some kind of sickness tablets because of the general anesthesia medication, sometimes making more nausea after the operation. Somebody is more sensitive about these things. And we are giving them some kind of creams, antibiotic creams if needed, bruising creams as a medication. But we provide all necessary stuffs also, except the medication, like BBL pillows, like the garments, upboard, backboard, the dressings, tapes, and baby oils for massages also, so that they doesn't need to buy anything about the operation, any kind of medication or any kind of stuff. Just they need to come by themselves and just bring the personal belongings, and that's it.
So I will continue with the next question here. The next question is, how can I convert the excess fat in my body to the advantage?
Yeah, that's what we are doing every day. Because you are carrying all the fat in, unwanted areas like low handles, like the upper back and around your tummy. So we are taking them and use them for the necessary areas like the hip dips and the projection. And in some patients, maybe breast fat injection, or for the face rejuvenation also.
So I will continue with the next one here. I think it's a patient question. I'm checking. That's also a frequently asked question here. What are your recommendations for patients who cannot gain the suggested fat? Would be a lower kilogram gaining amount suitable for the surgery?
Every patient situation might be different. There is a term which is called skinny BBL surgery. That means that you need to do the operation with much more limited fat tissue. And everybody has an amount of fat under their skin, but we need to have a very good evaluation for this kind of patients, because the fat tissue is all the time so much limited, and if they need to gain weight, they have to gain weight, and if they have enough fat underneath, so it doesn't matter, maybe just 2 or 3 kgs might be enough. It depends on the patient. We need to make an evaluation and give the recommendations in every single individual
Here we have also
cases.
some patients, for example, you are recommending them to gain, for example, 6 to 7 kilograms. But the question they're asking, is it also okay if I gain only 4 or 5, since it's not possible for them to gain more?
Yeah, sometimes it's yes.
So it depends from patient to patient,
It depends, yeah.
Okay, here the next question. What kind of service are you providing to the patients after the discharge from the hospital? Here our aftercare process while they are in the country.
Yeah, we are very strong about it, and we are very confident, and we keep the patients as much safe as possible, and feel them like they are in their home. So after discharging the patients, we are taking them to our hotel, and every day in daytime, our nurses are checking them all, change their dressings, and they do all their needs. If they need to take a shower, they are helping them. They are doing the all necessary aftercare processes like lymphatic drainage massages, and they are training them about all the long-term aftercare informations. And we have night shift nurses also. Every night, evening, our nurses are coming and checking all our patients with their all vital findings, that the blood pressure, oxygen saturation, with heart rate, with general health conditions, and feed them, give them water, make them mobile, and give them more moral, especially. And we don't leave them alone, never. And they don't feel themselves alone. So we are checking them every day and every day. Sometimes they are complaining about it. They are saying is, I want to keep some time with myself. Otherwise, we never
that's, I think, also
let them
something
alone.
important to make them feel like sometimes they're coming alone without any companions, so it's important for them to feel someone is here with them.
Yeah, for sure. The body shaping operations are not, small operations. They are big operations, and the patients are coming from abroad. We are trying to understand them, what they are, how they are feeling themselves while they are staying here, and it's not easy thing, never. So our purpose is try to make all the process as easy as possible, as comfortable as possible, and as safe as possible. That's all our efforts.
So I will continue with the next question here. Now we are here a bit, now we can talk a bit more about the breast surgeries, which is also asked a lot. The question here is, how much tissue can be removed with a breast reduction surgery?
Okay, and in this question also, it depends how much tissue you have before the operation. So if you have more tissue with more sagging, that means that we can remove more fat and skin tissue from the breast. But all the time, like the other body shaping surgeries, our purpose is to make the breast as natural as possible. Not too small, not too big, just in a good proportion for the chest width, for the shoulder width, and the body height of the patient. And usually it's accepted that the cup size of the breasts, if they are about B or C cup size, it's accepted as a natural. And we are targeting to have the cup size like B or C. But usually before the operation, especially on breast reduction patients, the breast cup size are likely G, double D, or H, but we are trying to take all these sizes up to B or C.
So here's also again a related question, like here the question is, what is the difference between breast lift and breast reduction?
Okay, that's a very good question. Technically they are very similar operations, the breast lift and breast reduction, because in the breast reduction surgery we are not making just a reduction, we are making a lifting also, because all the big breasts are saggy without any inception. And in breast lifting surgery also, even we don't remove that much tissue, they have some kind of sagging skin and tissue, and we have to remove it, but it's less than breast reduction surgery. So the main difference is the tissue removal amount, but the other technical details are so much similar.
So another question here, I saw it also in the comments down. You are performing breast lifts or reduction, which are really similar surgeries. Are you performing also breast lift with implants? And what is the difference from breast lift with implants? So how you choose which one is suitable?
Yeah, in my daily practice, the only indication for implant surgery is a volume deficit on the breasts. If your breast volume is good enough for your body, and in that case, just a lifting surgery would be enough. But if you have a sagging breast, and if your volume is not good and is not natural for your body, so we may need to make an implant support with a lifting surgery. Sometimes just just a fat injection with lifting surgery might be enough if the volume deficit is not that much. But the breast lifting with implant surgery, the only indication is the sagging and the volume deficit combinations.
Another question directly about implants. How long can a patient use the implants, and is it necessary to change them after a specific time period?
Okay, that's a good question also. And you know, in all generation implants before 10 years, 20 years, we were used to recommend to change the implants in about 5 to 10 years time. Even you don't have any problem about that. But in these days, because of the new generation implants are more compatible with the body, you don't need to change the implants any time of your life, as long as they don't give you any problem, like a deformity, like a pain, like a complication, like capsular contracture or something like that. So for that reason, if you are happy with them, with no issues, so just keep them with you for a lifetime. But you need to the checkups.
Like you mentioned, the capsular contracture. I will directly add the next questions about that. Here the question is, what is a capsular contracture and how can a patient avoid that?
Okay, so you know, every kind of implant, that might be and breast implants, teeth implants, or bone implants, anything, isn't foreign body for our body. So the body is always try to protect itself and protect itself from any kind of trauma, from any kind of danger, and any kind of foreign body also. And it's thinking they are, you know, treating the body, and it's trying to limit them with some kind of reactions. Once we put the implant inside the body is try to keep it in a, you know, capsule. It's an, you know, a natural reaction of the body. Normally, this capsule is being very thin and soft, and as long as it's like that, you will not have any problem in entire of your life. But somehow, in some patients, the body sometimes making a more, you know, exaggerated reaction, and this thin and soft capsule is being more harder and thicker, and it's pushing the implant, make it deformed, and it's making pain, and might make a deformation and significant asymmetry on the breasts also. In that case, the only solution to get rid of it is the removal of the implant with the capsule, which is called in-block resection, and do the necessary operation for the patient. Depends on her, you know, needs. If she needs a revision for a lifting, so you need to lift it and put a new implant. If her breast tissue volume is good enough after all this removal steps, so you can do just a lifting surgery without implant. After this capsule and breast removal, you need to make a revision for the rest of the breast tissue.
Okay, that was also something important, because it's also mostly asked and everyone is seeing on the social media videos, so it was important to share some details about that. Now I will change again the area right now and hear a question. The question is, which patients are suitable for vaginoplasty and what are its advantages?
You know, the vaginoplasty or the vagina is maybe one of the most, you know, underrated part of the body, because after the natural childbirth, unfortunately, mostly the vagina is getting deformed because of the injury, childbirth injury. And this is making some kind of deformities in the appearance of the vagina. It's making the vagina entrance wider than usual. And because of that, and the sexual pleasure might be less after this kind of deformities. But we can repair all this kind of problems and fix all this kind of deformities in a single vaginoplasty operation, or we can make a combination surgery like a mommy makeover or breast surgery, because the women doesn't prefer to mention about this problem. We are asking them if they have this problem, and sometimes most of them might not know anything about this kind of surgery. They doesn't think about it. They doesn't know but there is a solution for this. So we are asking them and make them think about it. And maybe the most patient satisfaction might be in this kind of operation. So because it's a simple procedure, it's not that much complicated. It's taking very short time, about half an hour, and it's making the life comfort much more higher. So we can do this operation as a single operation by itself, or we can combine it with other operations.
May you share also the aftercare process after the surgery?
On vaginoplasty, yeah, it's very quickly healed region, the vagina, because female genitalia blood circulation is too rich. So for that reason, the incisions are getting healed in a couple of days, and then they doesn't need to do anything else on there because it will be healed. But we need to recommend to keep away from sexual relationship about 1 month time after the surgery. And
so I will check, my questions are right now in general a bit done. I will check the comments. We have some questions in the comments, and I will check right now, go over them. So
okay, so our time is very
1 hour is
limited right
mostly
now.
done. So yeah, I will go quickly about the most important and most asked questions here. One question is, how much is recommended to lose before the surgery, the weight?
It depends the patient's situation before the surgery. We need to calculate it and give the information one by one to every single patient.
Another question here, we talk always, like the whole stream was about the woman, but we have also like male patients, and the question is about the gynecomastia here, since you are also performing this. Can you explain quickly about this process and its method?
Yeah, in male patient, the most satisfactory operation is gynecomastia, with no doubt. So the operation is very short operation, and after the operation, the recovery is very fast, and they are getting too much happy after the operation. It's not that much painful thing, and we don't recommend to stay at the hospital also. They can go back to their home in the same day, and in a couple of days, they can go back to their
mostly they are
routine.
coming for this procedure and have the hair transplant, for example, done, or the dental treatment. Can they have them done at the same time, or how is it working exactly?
If a patient wants a request for a hair transplant and another surgery in the same time period, so the hair transplant should be done firstly all the time, and after the transplant, the next day, 2 days after the hair transplant, we can do any kind of surgery
so
they request.
The hair transplant first, after like 1 or 2 days, body surgery.
Because of the hair transplant is taking too much time, and they need to lie on their face down and on the back. So if we do the operation, or gynecomastia, for example, operation firstly, the hair transplant operation might be more difficult and more painful.
There are also some questions about the breasts, which are, is it like, are the folds under the breast normal after the breast lift surgery, like on the scar? Yeah,
usually we are trying to keep the scar under the inframammalian fold, on the fold itself.
So that's something common for the patient side. I'm checking the questions here, if there are some important ones. Yes, okay, I will check for one which is asked our time.
And
Yeah.
we wish a good night
That's a
for
general question. I
everybody.
think I can ask directly this. That's also something about the aftercare, especially while they're here. It's about the massage sessions. Is it included to our aftercare process, and
Hmm.
how many sessions are recommended? The lymphatic drainage massage after the surgery.
Okay, yeah, that is one of the most important aftercare thing for any kind of liposuction or plus BBL surgery. We do the first massage right after the drain removal, which is taking about 2, maybe 3 days after the surgery. And after then, we recommend to have professional lymphatic drainage massages like a 10 session times in the first month, like every 3 days. But we show how they will do a self massages by themselves to the patients, which are needed to be done daily after the surgery up to 6 months. And the massages are making the skin tightening effect more. The connections between the muscle, fascia, and the skin is getting stronger, which is making the tightening more again. And it's taking all the leakage underneath of the skin, which is a common thing after the liposuction procedure. It's taking it out completely. And it's making the recovery of the lymphatic vessels much more effectively and quickly. And with that way, the swollen and edema is getting reduced more quickly than usual. And the patients are also feeling themselves much more released and comfortable after the massages. So it's, a must for us, the lymphatic drainage massages. And the other thing is the self massages, which are needed to be done every day.
Yeah, that's why we add also the baby oil for the patients. Yeah.
Yeah, that's the reason of
So
the
we have
baby
still a
oil.
lot of
Yeah.
questions, but we have no time left right now. I hope we can do this session one more time in a short while again, so we can answer also the questions from other patients.
Yeah, I that's good. I've been very happy to be with our patients, with our followers,
Yeah,
and why not?
since
We
there are
can
still
do
a
it
lot of
again. It
unanswered
doesn't
questions,
matter
so next
as
time
long
we
as
can answer these kind of
yeah.
questions to help them out. I want to thank you for your time.
Okay.
Thank you for all the explanations. I think they were
Thank
really
you too.
helpful and they were a really good guide way
Okay.
for our patients. So hope it was really helpful for them. And thank you.
Okay. And thank you too. Thanks for all followers, and I wish a very good night.
Good night, everyone.
Everybody.
I hope you enjoyed our stream. Hope to see you next time. Bye.
Okay. Bye bye.